Plunk. Okay, we are now officially recording. Just keep that in mind as we go forward. And as usual, I'll pop it up on the YouTube so you can look at it later as and when, if you need to, or just revisit if you want to come back to anything you've missed. Morning, Poppy. So, the final period. This is modern Britain from around about 1900 to now, literally now, which was later than when I wrote the stuff for the meeting itself. The same 4 boxes, but we're going to start making more comparisons. We'll talk about how people dealt with epidemics. We'll talk, and that includes this one. How did food and diet vary? And I guess it includes now as well. And we'll talk about how did housing conditions vary, or how do housing conditions vary? Don't worry about being late, it's fine as long as you're here. How did government deal with and respond to public health issues? So that's different to epidemics, just to put that into perspective. So, where would you like to start? Or which box? Do you have a preference, or do you just want me to do normal?
Do normal.
Do normal. Okay, we'll start with how do people deal with epidemics? There are a few to write up here. So, previous to, well, last year, which epidemic did we write up here? Or which epidemics? There were 2.
Cholera?
No, not from 1900. Cholera does not return after 1866. We actually
Spanish flu.
The Spanish flu, indeed. Was that what you were going to say, Maisie?
Yeah, I was going to say Spanish flu and AIDS.
AIDS is the second one. Good. So we've got Spanish flu. You see that as I'm writing it up? That's 1918 to 20-ish. And AIDS, which is the sort of quiet epidemic we don't really hear much about. And that tends to be sort of 1980s onwards. But of course, we can add a third. What can we add now?
Sir, please can you move it down a bit so I can see the top?
I can't. I can't move it down. But what I can do is I can move the camera a bit. Does that help? Can you see it?
Yeah.
Brill. Fair enough. Because yeah, it's a whiteboard. I can't physically move it. The third thing we can add, obviously. Oh, come on. You're better than this. Go on, Emily, say it. You know,
I didn't realise I wasn't on mute. Is it COVID?
It is COVID, of course, it's COVID. So.
Wait, so is that now included in the exam?
Why not? We're going to use it how people deal with epidemics. I would argue all 3 of these have common themes, despite having slight differences. So Spanish flu and COVID are very deliberately put in the same column. How do we deal with both of those?
Masks.
Masks, good. Mask wearing. We didn't talk about that when we did Spanish flu the first time round. Though all the photos I showed you showed people wearing masks, it wasn't something we really thought about. What else?
Quarantine.
Quarantine, good. Except it gets a new name now. It's the same for COVID, but we don't call it quarantine in COVID. We call it
Lockdown.
Lockdown. So quarantine develops. In the Spanish flu, it's not just people with the Spanish flu itself that are kept in their houses. Under Dr. Niven's plan for Manchester, he's the guy that comes up with this, it's not a nationwide thing. He's the Chief Medical Officer for Manchester from the 1875 Public Health Act role. And he argues that healthy people shouldn't be going out either. They don't come up with a name for it in the Spanish flu, but it's proven to work when Manchester doesn't suffer the devastating third wave that the rest of the country suffers. And so as a consequence of that, everyone says, well, in the next pandemic, that's what we're going to do. And lo and behold, we did. And we gave it a name. We called it lockdown. So we now have proof that the government listened. What else do we spot? Well, how else do people respond to this?
What does that doctor thing say?
Niven, Niven, is an important character when it comes to developing a response to Spanish flu.
Thanks.
No worries. What else do they do to deal with Spanish flu? They do quarantine, but not out in the world. Where does quarantine take place? Rather than lockdown, I mean. We're doing it again with COVID. Where do you quarantine? Where do you separate the sick from the well?
In your house.
Oh, that's a fair point, actually. It wasn't the point I was driving at, but you're right. So it's quarantine. They didn't do that with Spanish flu, but they're definitely doing that with COVID in own house. Fair point, fair point. But that wasn't what I was thinking of. I'm thinking of, oh, go on.
When they come back from war in Spanish flu.
Ooh. No, they don't. They're just going to lockdown. They don't quarantine immediately. That's a fair point. Not what I was driving at. How can I make this more obvious? My question was too general. You're not going to get this. Where is it necessary to make sure that people with different diseases don't mix? That might help.
Hospitals and stuff.
Well done, that's the one. Thank you. So they had special wards for Spanish flu, which of course we've seen again with COVID wards. And the mask wearing is part of what we term something different now, but is the same back then. What is masks part of? It's mask wearing by society, but there's also within those hospital wards, they wear, what do they wear?
Visors.
Visors didn't exist the first time around. Think the more general term.
PPE.
It's PPE, personal protective equipment. We now call it PPE. When we did Spanish flu, I just said they took precautions. I didn't have a word for it. We now have a word. They wear PPE. They just don't use that term back then. So going back to what Maisie was saying, yes, you can use COVID, but you see, it's not as big a deal putting it in as it first appears. The big difference between Spanish flu and COVID is what? What's the massive difference between the two in terms of response? Spanish flu has a successful response in Manchester that the rest of the country then adopts. In COVID-19, how is the response organised? Is it local governments?
No, it's national.
Indeed, so this is local response. I'll shorten response to RESP and local to LOC because why not? And this is a national response, a NAT RESP. There's also another difference. What isn't able to coordinate and set up a response across the country? Even if the national government decided to take an interest in Spanish flu, what couldn't they use because it didn't exist yet? There's been a major feature of the response in COVID-19. To the point where the first time round, there was applause. It's easier than you think. Promise.
Tracking it.
Test and trace. Ooh, now then, that's a good point. Yeah, that is a. Can you see that if I write over here? Yeah, you can. So test and trace, which has been awful, by the way, and remains rubbish. We've got 5 people with the Brazilian variant, but we don't know where one of them is, which is a ridiculous statement to make. Money well spent there. All right, that was something. No, you're hitting the nail on the head. You've done a very specific example of the general thing that I'm asking for. That's not a bad thing, by the way. That's really good. Because test and trace isn't just called test and trace. It gets another part of its name, so they all know what it is.
What, like records and like recording who earns what?
Well, that's what test and trace is. There's your big difference. But who organises that?
Oh, the government.
Through what?
The NHS.
There it is. There's your big difference. In 1918 to 20, the NHS didn't exist. There was no National Health Service. Of course, it had to be local government responses because there was no general national agency capable of responding. It wasn't that the national government wasn't interested. It was the national government could not control things. With the advent of the NHS in 1945, the big difference with COVID-19 is we can have a national response. And we've seen that the national response, in many ways, is better than a local response. They tried doing the local tier system before Christmas. It didn't work. And they said they won't go back to that because it didn't work. And that's interesting for us, because that was the message, that the lesson from Spanish flu. Local responses worked in local areas, provided they were run by local areas, but you needed a national coordinated effort to get everybody to do it. So that's one way of dealing with epidemics. Spanish flu and COVID-19, they're an epidemic. They're both flu-like in that they're airborne and difficult to control. In neither case was there any kind of panic, which is good. I would argue they work quite well together. I don't think I've gone into huge amounts of detail. How is this different to cholera?
Like, we're more developed in terms of like what we can do to resolve it.
We understood disease better. I'll go with that. So greater understanding. Yeah. Not what I was driving at, but it certainly worked. Can you see the green? So the methods deployed to deal with the spread of the disease and the methods deployed to look after those suffering from the disease were far superior. In neither case could we cure it once you've got it, but we understood how to prevent its spread better. Yeah, I'll go with that. That's a major difference. What's the other big difference?
Sir, I can't read the green.
Oh, see, I asked that as I was writing up and no one said anything, so I assumed everything was fine. It says greater understanding than cholera. I'll write it in black. I've written und rather than understanding. So it's und, U-N-D for understanding, because I was trying to be quick. Maybe not the best idea I've had. But there's another big difference as well. Who is doing the coordinating response here? What
The
method?
government, like,
It's government. Yeah, the government response is more organised.
sorry, that bit kind of cuts out on the camera.
The top bit.
Yeah.
Curses, give me a second. Is that better?
Yeah.
Sorry. There we go. And we used to finish with a success, like a major success, because you had reaction. This is a reaction to a problem. What happened with AIDS? Rather than reacting, what do they do?
Sir, what does it say at the top? Greater and...
It says greater und than cholera.
Oh, okay.
So
Thank you.
For understanding. So this is reactive. The disease happens and then government respond, and there's not a lot we can do about it but minimise the spread. What do we do with AIDS? We can't cure AIDS either. So what's different there?
Don't they like advertise a lot to try and scare people not to?
Good.
Yeah.
To scare people into taking it seriously. Why do they have to do that? Why do they have to scare people into taking it seriously? Surely a sexually transmitted disease is scary in and of itself. Why do they have to scare people?
They didn't really believe in it. They thought it was like only a gay disease.
Good. but it wasn't. And how do we know it was effective? How do we know that this worked?
It's like decreased now, like there's not as many cases.
Okay, fewer cases than, say, Belgium. Belgium's got a reasonably good healthcare system. Belgium tried their best to stop it spreading, but the UK has significantly fewer cases than Belgium. And that's not per capita, that's just a flat figure, and their population is smaller than ours. Who organised this response? It wasn't the government. Who organised it in their stead? They just got on and did it.
The NHS.
It's the NHS. The government said, you get on with it, and the NHS did. And without government intervention, they worked. And that's used to be where we finished, saying basically we've got better over time at dealing with epidemics. First we react, then we preempt it and get people to take action so that it doesn't spread. And you had the story of Black Death, no idea. Black Death, a little bit more of an idea, the beginnings of quarantine, response that actually works to preempting it entirely. And that was a nice, neat, over time way of looking at things. Things get generally better as we go through the history. But then COVID-19 turned up and proved that, all right, maybe that's not how history works. I mean, we always knew that. So when you're answering these questions, my point is, try to avoid going chronologically. Use comparisons by the order in which they make sense, the point you're trying to prove. One thing is not a factor in epidemics, which you might have otherwise expected. What doesn't play a role in how we deal with epidemics that you would have expected would?
Religion?
Oh, well, it does at the beginning, Aoife, so fair point. You could argue that with our modern epidemics, there's very little religion. That is a major difference. Yeah, I'll go with that. I'll go with that. But it does play a role in the early ones, so careful.
Miasma also kind of, that's not a thing.
By the wayside, absolutely. After germ theory, I think we knocked that on the head. But fair enough, that's gone. But it was there in the beginning. I'm saying there's something that plays literally no role from the beginning to the end, seems to make no difference. Another theme. So not just specifically about epidemics, but a theme that runs through the people's health. You'll have it written down in your notes somewhere, close to this review that you did at the time. No, it's science and technology. You'd think that that would play a huge role, but it doesn't seem to. In terms of how people deal with epidemics, science and technology doesn't seem to make much of a difference. It does in the particular, in the specific, but in the general scheme of things, it doesn't seem to play a role. Weirdly, you'd think it would, but it doesn't. It's very important.
How did it not play like a role if, like, from like Middle Ages to now?
Well, it doesn't, does it? You look at the responses to every single epidemic, how much of it is down to science and technology?
What about the germ theory and all of that?
Oh, you can mention germ theory, but again, does it make much of a difference in how we respond to things?
Well, then they don't believe it's miasma.
Yeah, but did that make much of a difference?
Not in the way they reacted.
And that's the point I'm making. Science and technology is incredibly important, but not in the way that people react. And you'd think it would play a huge role. The instinct is to say, oh, well, it's very important. But then you look at it and go, well, oh, actually, maybe not. It's important in other ways. You're dead right. In the type of PPE you use, in being able to identify what causes the spread of germs, but not in terms of how we react to it. And that's interesting. I'm going to point that out, that's all. So if you're using an essay about science and technology versus another factor, you might want to throw that in there and say, oh, yeah, well, it doesn't actually change how people respond. It just gives us better ways of responding.
I'm just thinking, like, for COVID and technology, obviously, because we knew about it was where it was happening first. So other than our government, like different governments had time to prepare.
It's
Oh,
mainly in the UK, so you're right.
Oh, so the
That
government did
distinction
nothing.
you make,
Yeah.
when our government didn't respond, despite having the knowledge, that I think right there is the fascinating part. It should have,
Like, could you put that in, like saying that we had technology, but the government didn't use it?
depending on the essay, yeah, why not? And then you could contrast it with AIDS, where we had the technology and we used it. We were able to say, look, this is going to be a problem, and then did something about it, versus this is going to be a problem, and it probably won't be a big problem. Yeah, that would be a good, that's very high level stuff. I like that. That's almost A level, that is. I say almost A level, it is A level. All right, next box. I'm already at the top, aren't I? I'm okay if I sort of switch the focus a little bit. I'll take the silence as a consent. Let us switch focus a little bit. Over there, thanks, Emily. Let's do, how did food and diet vary for society in the modern era? We didn't do a huge amount on this. In fact, I think the biggest bit we did was the first time we did the review. What groups in society are relevant when we're talking about food and diet? In the modern era. When we last looked at it, we split into 3, I think. How many do you split into this time?
3.
What are you 3?
Lower, middle, and upper class.
Are there many upper class people in Britain today?
I don't know.
The answer is no. There are very, very few. I mean, you could talk about the monarchy perhaps, but they're hardly indicative. They're not historically significant. So you only need, and it's not lower class. Oh, lower class doesn't exist. What is it we have?
Poor.
We could call them the poor, or we tend to call them the working class, sorry, and the middle class. Not a lot has changed in terms of class structure since the industrial era, basically. We've kind of lost the countryside. The working class, how does diet develop over this period? So early on, we start out with, well, what happens to their diets, say, from the First and Second World Wars? What happens to the diets? That's, I should put an and rather than a plus there. And there we go. What happens to the diets of the working classes and the poor as a result of the First and Second World Wars? This is counterintuitive. That is, it's not the answer you expect.
Does it get better?
Absolutely amazing. They improve because suddenly everyone gets rationing. Rationing. And it actually works. Improves diet. Because suddenly they can only get, well, they can get more food. Poor people actually get more food under rationing than they did before rationing, which is weird, but there you go. And the quality of diet improves. There's more vegetables. They don't boil until they go white, for example. And therefore, increased vegetables. And what else happens as a result of things like supermarkets and as a result of world trade and joining the EU? No, seriously, this is part of it. What happens as a result of that? What happens to food that you can get in the shops? You're used to this. You probably don't even think about it. Specifically fresh food.
There's more variety.
Yes. Go on.
Well, you just get foods that you wouldn't usually get. You get foods from abroad.
Oh, yeah, there we go. So non-local produce. That's why I was trying to push you further, because there's 2 ways that works. No, so for example, bananas. You can get bananas. That's weird. We don't grow them in this country. We don't grow them anywhere near this country. You can get banana or kiwi fruits. They're from New Zealand. That's a long way away. What else can you get? Not just non-local produce.
Cheaper, like more unhealthy food is cheaper.
I'll come on to that. Hold that thought. I'm coming back to that. I'm doing this chronologically.
What does FWW mean again?
First World War.
A variety of drinks, like alcohol.
I suppose. I'm not sure that's a huge issue, but yeah, okay, fair enough. There's you know, I'm going to put these points down here because you're both right, but they're relevant later on. So greater and cheaper.
Really sorry, but what does the under like World War One begins with a K? Or rationing? Never mind.
Rationing. Sorry, it's my awful handwriting. And then you said unhealthy food is cheaper. I mean, you're right on both of those points. The diet gets worse over time, leading to obesity, which isn't just being fat, it's having the wrong fats in the body. You can eat very little and be obese because the fat doesn't get dealt with by the body can't use it. It's like McDonald's food, for example. McDonald's food, the vast majority of it simply has no contact with the rest of the human body. It just goes straight through and comes out the other end because the body can't break most of it down. It tastes good though. Well, does it? I'm not sure. It's got things like MSG in it, which makes the body want more of it. But the body can't break down a lot of the things that are involved in the production of that food, and therefore you end up fat because it's got a lot of saturated fats in it, but you don't end up terribly healthy. So you can eat very little and end up obese, weirdly. But we've missed one of the positive. I mean, all this is a result of supermarkets and world trade. I suppose put that in. Which is a huge difference from the industrial era when it was mainly railways. It's not just non-local produce like bananas. When you went to the supermarket last, did you see strawberries there?
Yeah.
It's just not like you can get food from any season.
There you go. I forgot it from that. It's non-seasonal food. So I bet you didn't know, because I didn't when I was your age, apples really only grow for about a third of the year. You shouldn't be able to get apples before spring, or sorry, not before spring, after spring, up until around about August. But we have them year round because we can grow them year round. And as a consequence, you have them non-seasonally. Strawberries are another good example. They're supposed to be around spring, summertime, but you can buy them at Christmas and all the way through winter because we have farms that grow them in special conditions. A number of reasons for the supermarkets world trade, but also they get it because of intensive agriculture or intensive industrial agriculture, I should say. All of this led to cheap food, and you're at the end of that era. My generation grew up with cheap food, plentifully available, more than we could possibly ever need or want, producing way more than was necessary, and as a consequence, food was incredibly cheap. Now, it still is cheap in our society, but globally, it's getting more expensive. Sooner or later, that's going to affect us. Probably sooner, given Brexit and price rises on that one. So you've already pointed out that there's a greater variety and a cheaper availability of alcohol now than there has been in the past. So poorer people tend to turn to alcohol. And unhealthier food is cheaper. So processed food using lots of salt and saturated fats is cheaper to buy than fresh produce. And you can prove that by going into any supermarket. Buying fresh veg is more expensive and getting more expensive. Poorer people can't afford that, and so their diets are getting worse, leading to things like obesity. You could also bring in smoking here, I guess, in that smoking and alcohol consumption increased during the middle part of this period and then have slowed down. But I'll come on to that when we're talking about government dealing with and responding to public health issues. What's the difference with the middle class, you or me? How do we eat differently to the working class and the poor?
Lots of meat.
Not lots of meat. Do we eat lots more meat than the working classes these days? I suppose you're going to put that in there. More meat. Because poorer people want to eat like richer people did in the past. We've seen that already. So there is more meat for the working classes. Do we eat much more meat than working classes?
There's more like variety in what we eat. So there's more kind of stuff like salads with fancy stuff in.
Well, oh, now then, that's an interesting.
Like there's and then there's also like vegan and vegetarian and all that.
Yeah, I'm going to add that in. Salads, vegan, veggie. That's an interesting reversal. What's special about middle class diets? I mean, they do all of that, but there's more variety. The salads, vegan, veggie, more sort of interesting foods. What does that mean about the diets of the middle classes compared to the working classes in general?
So you're kind of in the way a bit.
Sorry. I mean, you've sort of hinted at it here, but what have you hinted at? What is it you've correctly identified with the salads, vegan, veggie? What can we say about middle class diets?
They're a lot healthier.
They're a lot healthier. And
More fish as well, like there's lobster and stuff.
oh, I suppose, yeah, there's fish in that. I've not really included fish in here, have I? You can add that in, absolutely. I mean, we talked about fish becoming more available, but you're right, there's more varieties. We've had to change those varieties because of our attitude to food. The diet has changed to deal with the fact that we've fished out a lot of the fish we used to eat. So things like pike and trout have disappeared from our diets because there aren't as many of them. And we've replaced them with things like cod and haddock, which are dying out, and replacing those with pollock and whitefish. So you're right, we are changing the varieties of fish as we slowly eat them all. So yeah, fair point to make. I'm not going to write took, so I'm almost out of space, but it's an absolutely good point to make. You could throw that in an essay very easily, because there's a difference, a comparison to be made with things like the Middle Ages or the early modern era, when food was plentiful enough that you couldn't really hunt it out. Now we can, because we're eating so much more. The volume of our food has increased.
So,
yeah,
what does the FWW mean?
First World War.
What was that?
First World War.
And the S one?
So if F is the First World War.
Oh, right.
There you go. I knew you'd know. So yeah, the big issue here is the volume of food consumed by everybody is up from the past. That's actually a big change. And the quality of food has changed. I mean, we've got processed food that's actually worse than fresh food, which is weird, but there you go. It's cheaper though. And frankly, I don't know, occasionally I do like a Finder's pancake. Really bad for you, but they taste so nice. Oh, and Bombay Bad Boy. Oh, I loved those back in the day when they were full of MSG and all the things that your body can't process. I absolutely adored them. I'd have a special one a week, Bombay Bad Boy. Oh, because it was awful and bad for you, and it tasted lovely. Sorry, that's more information than you probably needed. They took the MSG out. I stopped eating them after that because they weren't as interesting. They're much healthier now than they were. I don't know, man. Am I okay to move on? Okay. Okay, silence is consent. Let's do the housing stuff. Because this is the point you sort of hinted at last lesson and you were quite good at. Oh, that's my microphone way in the way. Let's get rid of that. There we go. So how did housing conditions change? What was the big change in the 1930s? You hinted at this when we were talking about industrial Britain. So I know you know.
Looks.
So what's that?
Looks.
Looks. Did you say looks, Jerry? Sorry.
No, I said toilets.
Oh, toilets. Oh, yes, but they've been around since 1876 in the Artisanal Dwelling Act that said you had to have a toilet built into the house of any new building. So what changes?
New
Knocked down.
buildings.
So was that, Aoife?
More new buildings.
Why are there more new buildings?
Because all the old ones aren't up to standard.
That's not why they're doing it, Aoife. No.
More health regulations.
Yeah. Why are they building new buildings and not just upgrading existing ones? What's the big deal in the 1930s that changes housing stock? Go on, Poppy.
Like they're not safe enough to live in.
So what do they do with those existing?
Not
What do they call those low quality housing? What are they called?
Knock them slums. They knock slums down.
They knock the slums down. It's called slum clearances. They knock them all down. That's in the 1930s. And what do they replace them with? There are two things.
Flats.
They do in the 1960s and 70s. You've got streets in the sky. Designed to be healthier because they're airier, they're lighter. That idea of miasma clearly hasn't gone away entirely. And they build up rather than across, so that you don't end up with open sewers and such. And I have this soft spot for that kind of architecture where you can see the hope and the dreams, and you go and you see how it died. And I love that sort of thing. It's very melancholy. But they don't just replace them with streets in the sky. I mean, the slum clearances happened in the 1930s. These things aren't built to the 60s and 70s. There is something that starts earlier than that. Where do they put the poor to live? What sort of housing do they get? Because they can't afford to buy it, not initially. So what kind of thing do they build?
What, is like homeless shelters and stuff?
No, not homeless shelters. You don't turf people out of the slum and say, you're homeless now, deal with it.
Oh, it's like really like low quality flats and stuff.
The flats aren't around yet. Go on, Liv. You were going to say something.
Is it the council houses?
Very good. Well done. It's council housing. And that's from the 1919 Addison Act. That sets up the very first council housing anywhere in the country. So it's local councils owning houses that they build at their own expense. Most of the semi-detached houses you will see with those weird bay windows, they start out life as council houses. They were designed for poor people. There are also prefabricated houses that are built out of modular bricks and sections, which are significantly better. A lot of modern houses you'll go and see with those doors that don't have panels. They were designed to be easy to clean, with square rooms that were easily hoovered and easily mopped up or brushed down, so that you didn't end up with the squalor and the disease. They were very carefully designed to be clean. So I guess I also include clean lines. Design features. So you stop building these huge villas with servants' quarters, and you start building quite small, boxy, deliberately boxy, straight-edged houses designed to be easy to care for. And a lot of you will probably live in houses as a result of that design change. Yeah, I mean, I could go into this. I get very excited about this sort of architecture. In the 1920s, they tried to make it look good. But then, of course, there's the economic crash. So in the 1920s, you end up with a lot of curved outer walls and balconies and 3 or 4 floors in a house. Whereas in the 1930s, when councils don't have as much money, you end up with these semi-detached boxy houses with a bay window to make it look nice. But generally speaking, the rooms are all square, and you get that 3rd bedroom, which is actually a box room. And you don't end up with basements, and you don't end up with attics in the same way. So I could go on for days about this. It's great fun. So who lives in these sort of houses then? Who are we talking about? Which group? It says, how does it vary for different groups? Who lives here?
Working class.
It's the working classes, specifically the poor working classes. Good. And what do middle class people start living in? People like thee and me.
Townhouses.
Yeah, townhouses. We live in the same sort of houses, but there's a crucial difference. We don't live in council houses. What do we live in? Same design features, same architecture. What's the crucial difference? Some of you might even live in a semi-detached house with a bay window that I've just described, and you're like, well, I'm not working class. My family's middle class. What's your difference? I'd argue, I don't know for certain, but I'd argue everyone here can say this about the house they live in. Go on, Maisie.
They own it.
You own it. Yeah. So you've got more modern housing, you've got cleaner housing, you've got boxier housing, to make it easier to clean, I mean, not to make it smaller. And it's yours. You get to sell it. People living in council housing don't, they rent. I mean, that changes. There are some changes here. You could talk about the right to buy scheme of the 1980s that meant that a lot of people living in council houses were able to buy them at sort of 1940s prices in the 1980s, meaning that they would buy a house for, like, I don't know, say £2,000, and then they could sell it for 40 to 50 grand on the open market, which is a massive increase in wealth. For some people, not for a lot of people, just for some. It was very popular though. Is there any other major difference? Oh, there is. What's the big difference? It's not really between middle class and working class here. What's the big difference in modern housing? And when we talk about streets in the sky, we talk about council housing. I talked about the clean lines and the modern housing, but some of you will live in Duffield or Belper.
Like the areas that we live in have changed. Like it's more.
So where's the difference in architecture and housing?
It's more rural. I don't know.
Good. Yeah, it's rural versus cities. Rural is posh for countryside. And that's your big difference. In the countryside, very little has changed. You could argue that the housing is almost exactly as it was, in some cases in the early modern era, but mostly in the industrial era. You've got your brick-built farmhouses with multiple wings. And in the cities, we're getting smaller and smaller housing as things get more and more cramped. Duffield is somewhere in between, I guess. Housing estates. I nearly forgot. Housing estates. Where am I going to put that? Housing estates. I'll put it there. Where whole areas of housing are built in towns and cities with parks and pathways. And, oh, that sounds a lot like the 1690s. That's because it is. All that's changed is the building materials. So I think you'll have a card sort on this one where I went through changes in the 20th century. I'm sure I remember doing that, where we talked about schools and whatnot as well, and services.
Yeah, we did.
Good, good, good. Check your notes for that one, because that's where all this comes in. That's what I was talking about. And you can compare that to previous eras. They don't move as quick, but the big difference is rural versus city. Rural seems to stay in the past, not in a bad way necessarily, whereas cities accelerate forwards, also not necessarily in a bad way. Anything you want to raise here? Anything I've missed? I'm aware that I've not written very much, but we've talked around it a lot, you see. Okay, okay. I'll move on to the final box. All right, so public health issues, our final section. We've already tackled a lot of this. I've kind of already hinted where we're going. You probably already know what's going to go in this box. So what kind of public health issues do the government deal with? I mean, we've literally just talked about it, in case you're wondering. So if I get out of the way.
They knock down slums.
They knock down the slums, yeah. Unhealthy housing is replaced. There was the promise of the first Prime Minister after the First World War. What was it? Here's fit for homos. I mean, sorry, homes fit for heroes. And then slum clearances. Oh, there was another thing. How did the slum clearances end? Why did they end quite effectively in the 40s and 50s? What had happened to most of the slums in places like, I don't know, London?
They've been bombed.
They've been bombed. So the government built new buildings. They had space. Cheaper, I suppose, than bringing in demolition groups, isn't it, fighting a war? So unhealthy housing stock is replaced. They fix it. And you can date these. So we've got 1918 Homes Fit for Heroes, leads to the Addison Act in 1919, slum clearance in the 1930s, and Second World War damage, 1940s and 50s. Which essentially causes the government to fix the public health disaster that were industrial towns and cities. All right, how else do they deal with things? How do they deal with bad diets? What do they do in schools? Now that everyone has to go.
Free school lunches and stuff.
Yeah, free school meals. That's from 1914 onwards. Excellent, good. What else do they do in lessons? You've done some of these. Now that they control schooling and they control the curriculum, what do they make you learn about? Sorry?
Jabs and stuff.
Oh, yeah, and vaccination programs. Absolutely. Sorry, yeah, that is carried out in schools, but it wasn't what I was thinking of at all. I suppose that's more pressing at the moment. Yeah, absolutely. Vaccination programs. The very first of these is carried out, by the way, in 1857 with smallpox. But you're right, the scope and size and reach of these increases dramatically since 1900. To the point where you can even use the COVID vaccine as an example to prove the point. Previously, we're talking about taking vaccines and vaccinating a population over, say, 5 to 10 years. We're trying to do it in less than a year, and we might even manage it. That is astonishingly quick. In fact, we've done the whole procedure in two years: research, development, production, and possibly vaccination. That is really quick, and proves a point, I think, about how you can use, if there's political will, government aid and agency to make a huge difference. So yeah, absolutely. There's a way of using it, Maisie, that is incredibly relevant, I think, and proves a point. Not what I was thinking of, though, but you're dead right. What do they do in schools that you've had to do in PDC? You might have had to do it in primary school. What sort of lessons do they teach you to do with public health? I can think of several ways you can do this. Or let me put it another way. What do you know about food?
Like, what's healthy and what's not healthy?
How do you know that?
Because we've been taught that.
There you go. Healthy eating lessons. Do you want to know when they were first introduced to schools? Do you know already? I don't know. It's the 1990s. What was banned in 2007? You're not allowed to do it anymore. You've grown up in a world where it's normal.
Is it advertisement for unhealthy foods on telly?
Oh, that's later. But you're right. That is something else. Spot on. Yeah, sorry. Because I've mentioned healthy eating, isn't it? You're right. That is a link. It's not in 2007. That was later. I think it was 2011. But absolutely, get that one down. I'm not going to write it because I'm running out of space because my handwriting's awful. So in the 1980s, you couldn't do it on TV. And from 2007, what were you not allowed to do anywhere? In public, anyway.
Like, it's not smoking, but like stuff to do with smoking. You're not allowed to like, smoke kids in the car and stuff.
It is smoking. You're not allowed to smoke in public. It's absolutely smoking. And in the 1980s, you weren't allowed adverts on television anymore, which included not showing people smoking as a good thing on things like children's TV, which did exist before then, frighteningly enough. What else do you get educated about? It's not just healthy eating. What else do you get educated on the dangers of?
AIDS.
Oh, yeah, okay, yeah. AIDS education, yeah, sorry, yeah. I love it when I ask a question where I've got an answer in my head and you guys come up with something I hadn't considered that is also right. It's brilliant, I love it. Sorry, John, I hope you weren't out on the lesson for long. But yeah, we've got that AIDS education. Wasn't what I was thinking of at all, but absolutely vital. And yeah, you're dead right. What else?
Like drugs and alcohol and stuff.
Drugs and alcohol. Which has actually reduced the amount of alcoholism and drug dependence. You might not realise it, but drug use is on the downward trend, or at least it was pre-COVID. And so was alcohol abuse. It was on the downward trend and had been since the early 1950s. So it works. It absolutely works. You might not think that, but it scarily does. So government are making huge amounts of difference. They're taking, well, what could we say compared to previous historical eras?
Please, can you pan the camera down a bit?
Sorry, Jeremy.
Thanks.
No worries. Is that also, actually, I've straightened up as well. Is that better? There we go.
Yeah, thanks.
So what can you say about this set of examples compared to every other historical era we've covered? About government action and government dealing with problems and issues.
This is the era they actually do something useful.
Absolutely. I mean, they start in the industrial era, but here's where it comes home to roost and it seems to make a massive difference. It's almost like they went, oh, we can make changes in the industrial era, and then they do in the modern era. I've just given a smattering of examples. There are plenty more. And I think the first time we did this, you've probably got more detail in this box than I've put in this time. But the point is the comparison. Is that all right? Is everyone able to follow all of that?
Yeah.
Excellent.